This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am Anuja Kumar and with me is R.S. Raghu. The headlines. Government sanctions 15,000 crore rupees for COVID-19 emergency response. Prime Minister Narendra Modi and South Korean President Moon Jae-in discuss steps to tackle COVID-19 global pandemic. Home Ministry says states are effectively implementing lockdown measures and steps are being taken to help those stranded. Government says all efforts made to ensure adequate supply of fertilizers for upcoming Kharif season. Railways distributes over 8,50,000 cooked meals to needy people since 28th of last month. Government dismisses media reports and rumours about reduction of pension by 30% in wake of COVID-19 outbreak. And Islamic seminary Darul Uloom Deoband in Uttar Pradesh asks Muslims to follow COVID-19 lockdown restrictions. The centre has sanctioned 15,000 crore rupees for India COVID-19 emergency response and health system preparedness package. Out of this, 7,774 crore rupees will be utilised for immediate COVID-19 emergency response and the rest for medium-term support of 1 to 4 years to be provided under mission mode approach. A report.
The key objectives of the package include mounting emergency response to slow and limit COVID-19 in the country through the development of diagnostics and COVID-19 dedicated treatment facilities, centralized procurement of essential medical equipment and drugs required for treatment of infected patients. Besides, the aim of the package is also to strengthen and build resilient national and state health systems to support prevention and preparedness for future disease outbreak. It also includes setting up of laboratories and bolster surveillance activities, biosecurity preparedness, pandemic research and proactively engage communities and conduct risk communication activities. These interventions and initiatives would be implemented under the overall umbrella of Ministry of Health and Family Welfare. With Mohammad Naseem, Anand Kumar, AIR News, Delhi.
Prime Minister Narendra Modi and South Korean President Moon Jae-in discussed COVID-19 global pandemic today and the challenges it posed to the global health systems and the economic situation. During the telephonic conversation, both the leaders shared information about the steps taken in their respective countries to tackle the pandemic. The leaders agreed that their experts would continue to consult each other and share experiences as they research solutions for COVID-19. Mr. Modi expressed appreciation for the technology-based response deployed by South Korea for managing the crisis. He also expressed appreciation to the Korean government for facilitating supplies and transport of medical equipment being sourced by the Indian companies. South Korean President Moon Jae-in appreciated the way Indian authorities have motivated the vast Indian population in the fight against the pandemic with unity of purpose. The Korean President thanked Prime Minister Modi for the support being provided by Indian authorities to the Korean citizens in India. Prime Minister Narendra Modi today said, India shall do everything possible to help humanity's fight against COVID-19. In response to US President Donald Trump thanking India for decision on hydroxychloroquine, Mr. Modi said in a tweet that Indo-US partnership is stronger than ever. He said times like these bring friends closer and together this fight shall be won. The US President had earlier thanked India and the Indian people for the decision on HCQ, saying it will not be forgotten. He said Prime Minister Modi's strong leadership in helping not just India, but humanity in the fight against the pandemic is laudable. President Bolsonaro, in his address to the nation today, thanked Prime Minister Narendra Modi and the people of India for helping Brazil tackle the COVID-19 outbreak by providing raw materials for hydroxychloroquine production. He expressed gratitude towards the Prime Minister and the people of India. Prime Minister Narendra Modi had a telephonic conversation today with President of Uganda, Yoweri Kaguta Museveni. The two leaders discussed the health and economic challenges arising out of the COVID-19 pandemic. The Prime Minister assured President Museveni that India stands in solidarity with its friends in Africa during the present health crisis. Mr. Modi said India will extend all possible support to the Ugandan government's efforts to control the spread of the virus in its territory.
A total of 5,865 confirmed cases of novel coronavirus or COVID-19 have been reported in the country so far. Out of the total cases, 477 patients have recovered and have been discharged from the hospitals, while 169 patients have died. Briefing media in New Delhi today, Joint Secretary, Ministry of Health and Family Welfare, Love Agarwal said Health Ministry has formed high-level multidisciplinary teams to support states.
हेल्थ मिनिस्ट्री ने स्टेट और सेंटर की सपोर्ट करने के लिए हाई लेवल मल्टी सेंट्रल टीम्स भी कुछ नॉमिनेट की हैं, जो कि स्टेट्स को कोऑर्डिनेट करते हुए कंटेनमेंट प्लान, हॉस्पिटल प्रिपेयरनेस और वेंटिलेटर मैनेजमेंट उनके साथ कोऑर्डिनेट करेंगी। ऐसी 10 टीम बनाकर 9 राज्यों में भेजा गया है, जिसमें बिहार, राजस्थान, गुजरात, कर्नाटका, मध्य प्रदेश, महाराष्ट्र, तमिलनाडु, तेलंगाना और यूपी स्टेट्स हैं।
He also said Group of Ministers GOM had a high-level meeting in New Delhi today in which containment and management and setting up of dedicated COVID-19 hospitals and expediting this in coordination with states were discussed.
20 डोमेस्टिक मैन्युफैक्चरर्स इस देश में पीपीईज के लिए डेवलप किए जा चुके हैं। 1.7 करोड़ पीपीईज के अब तक ऑर्डर भी प्लेस किए जा चुके हैं और जिसके तहत सप्लाईज भी आना शुरू हो चुका है। इसके साथ ही 49,000 वेंटिलेटर्स के भी ऑर्डर प्लेस किए जा चुके हैं। साथ ही इन टर्म्स ऑफ लैब हमारी स्ट्रैटेजी क्या हो, उसके ऊपर भी डिटेल डिस्कशन हुआ, जिसके तहत कि हम हॉटस्पॉट या जो हमारे क्लस्टर्स वाले एरिया में है वहां पर हम लैब सैंपल्स को कैसे बढ़ाएं, उसके बारे में भी डिटेल डिस्कशन हुआ।
Joint Secretary in the Home Ministry Punya Salil Srivastav said that the lockdown measures are being effectively implemented by the states. She said the state governments are taking a number of steps to help those stranded due to lockdown.
राज्य सरकारें लॉकडाउन के एनफोर्समेंट में कार्यरत हैं। साथ ही साथ जो व्यक्ति लॉकडाउन की वजह से स्ट्रैंडेड है, उनकी सहायता के लिए राज्य सरकारें कई कदम उठा रही हैं। वे हेल्पलाइंस, एप्स, रिलीफ कैंप्स, शेल्टर्स, फूड कैंप्स इत्यादि द्वारा उनको सहायता दे रही हैं। इसके अतिरिक्त गृह मंत्रालय में भी जो कंट्रोल रूम सेटअप किया गया है, उसके द्वारा कल कुल 300 से ज्यादा समस्याओं का निदान किया गया। नॉर्थ ईस्ट के लिए लगाई गई हेल्पलाइन 1944 भी सुचारू रूप से सेवाएं प्रदान कर रही है।
Chemicals and Fertilizers Minister D.V. Sadananda Gowda has said that the government is making all efforts to ensure an adequate supply of fertilizers for the upcoming Kharif season. In a tweet, Mr. Gowda said, as of now, availability position is comfortable. He said, Department of Fertilizers is closely monitoring the production, movement and availability of fertilizers and is in regular touch with state governments. Referring to Karnataka, the minister said there is no shortage of seeds, fertilizers and pesticides in the state. He said the ministry is working in close coordination with the Karnataka government on this matter. Mr. Gowda said as of now, the state has a stock of 7.3 lakh tons against monthly requirement of 2.57 lakh tons. Railways have distributed over 8,50,000 cooked meals to needy people since 28th of last month. Railways Ministry said that more than 5 lakh cooked meals were prepared in IRCTC kitchens and is being distributed to beggars, children, porters, migrant labourers and stranded persons around railway stations. The Railway Protection Force has played a major role in the food distribution to needy people prepared by IRCTC, NGOs and from its own kitchens. The ministry said IRCTC has also deposited 20 crore rupees in PM CARES Fund.
The government today dismissed the media reports and rumours that it intends to reduce pensions of its employees by 30% and terminate it altogether for those above the age of 80 in the wake of COVID-19 outbreak. In a tweet, the Press Information Bureau has clarified that there is no such move in the government and rumours are baseless. The centre has introduced Arogya Setu IVRS facility on trial basis in Tamil Nadu. As the Arogya Setu mobile app works in smartphones, the IVRS facility works in feature phones as well. It was launched by the Union Minister for Communications, Information Technology and Law and Justice Ravi Shankar Prasad and the State Chief Minister Idapadi Palaniswamy jointly through video conferencing today. The technology has been developed by the IIT Madras jointly with the public sector BSNL. Minister Ravi Shankar Prasad in his address lauded the cooperation by the state governments to the centre in jointly fighting against the disease.
We have just launched Arogya Setu IVRS, in which the BSNL has played an active role in giving all the lines, etc. It works very simply. There is a number 9499912345 on which a call is given, missed call. There is a system which immediately responds to a person who needs help or who is developing symptoms, assistance, detection and guidance from the health system as to where he should report. And all this data voluntarily collected.
Chief Minister Idapadi Palaniswamy said the IVRS facility will provide assistance to the callers based on their health conditions. The Panchayati Raj Department of Uttar Pradesh is spearheading the fight against the novel coronavirus and working in tandem with the other ministries. In an exclusive interview with AIR News, Minister of Panchayati Raj Department in the state, Bhupendra Singh Chaudhary, said that apart from sanitization work, they are giving facilities at the quarantine centres at the ground level in villages and providing vital information to the government.
सभी ग्रामीण क्षेत्रों में बाहर से आए लोग के विषय में जानकारी एकत्रित करके जो बाहर से लोग आए उनकी सूचनाएं जिलाधिकारी के माध्यम से शासन को उपलब्ध कराई गई है। पूरे प्रदेश भर में जो लोग बाहर से आए हैं उनकी व्यवस्था ग्रामीण क्षेत्रों में, प्राइमरी विद्यालयों में, पंचायत भवनों में क्वारंटाइन करने की, उनकी रहने की व्यवस्था, खाने पीने की व्यवस्था विभाग के सचिवों के माध्यम से, प्रधानों के माध्यम से की जा रही है।
Mr. Chaudhary said that Panchayati Raj Department is actively involved in spreading awareness regarding COVID-19 and the employees of the department and even Pradhans have donated their salaries to the State COVID Care Fund.
विभाग के सभी अधिकारियों और कर्मचारियों ने अपना एक दिन का वेतन कोरोना केयर फंड जो माननीय मुख्यमंत्री जी ने बनाया है उस एक दिन का वेतन भी हम लोगों ने दिया है। सभी जिला पंचायतों में जो उनका जिला निधि होती है उस जिला निधि को भी कोरोना केयर फंड के लिए जिला पंचायतों से भी आग्रह किया गया है।
Amid the novel coronavirus contagion, governments in many countries, including in India, have advised citizens to use masks. Central government urged people to use masks and cover mouth and nose as this is believed to be the first line of self-defense in countries' fight against COVID-19. Our correspondent has filed this report.
Government has already classified mask under the category of essential commodity, but if you are not a health professional or directly indulged in handling COVID-19 patients, you may choose to make one for yourself. The N95 masks and surgical masks are much more required by health professionals. Making a mask for protection while stepping outside home is fairly simple. You can use any old t-shirt, cloth, handkerchief or any other fabric which suits you. It should be cut out in such a way that it covers nose and mouth properly. For better protection, you can also use 2 layers of the fabric. Strings can be attached to the ends of the clothes so that you can wear it. Make sure that you make at least a pair of such self-made masks so that you can wash the other one after a day's use. Anand Chaturvedi, AIR News, Delhi.
Islamic Seminary Darul Uloom Deoband in Uttar Pradesh has asked Muslims to follow lockdown restrictions to contain spread of coronavirus. The seminary also asked Muslims not to visit graveyards and mosques on the occasion of Shab-e-Barat. In an open letter to the Muslim community, Muhtameen, Vice-Chancellor of Darul Uloom Maulana Abdul Qasim Nomani said that the government has imposed a lockdown due to COVID-19 pandemic. He said it is the duty of every citizen to follow it. He said Islamic law also advises the same and all Muslims should follow lockdown and not be careless. Nomani also asked Muslims not to visit mosques and graveyards on Shab-e-Barat. Darul Uloom is Asia's largest seminary and is based in Deoband in Saharanpur district. This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Government sanctions 15,000 crore rupees for COVID-19 emergency response. Prime Minister Narendra Modi and South Korean President Moon Jae-in discuss steps to tackle COVID-19 global pandemic. Home Ministry says states are effectively implementing lockdown measures and steps are being taken to help those stranded. Government says all efforts made to ensure adequate supply of fertilizers for upcoming Kharif season. Railways distributes over 850,000 cooked meals to needy people since 28th of last month. Government dismisses media reports and rumors about reduction of pension by 30% in wake of COVID-19 outbreak. Islamic Seminary Darul Uloom Deoband in Uttar Pradesh asks Muslims to follow COVID-19 lockdown restrictions. For quick news updates around the clock, follow us on our Twitter handle at AIR News Alerts.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion on COVID-19. Dr. Balbir Singh, senior physician, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. In our series Experts Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, Dr. Sanjay Pandey of JB Pant Hospital, New Delhi, said it is a novel coronavirus and one cannot say for certain if the hot weather will make any impact on the spread of the virus.
Coronavirus is a respiratory virus, and in the past, most of the respiratory virus like H1N1 and SARS virus, their epidemic was less in the hot region. Even in India, there was no much impact because the weather was little hotter here, and that is the presumption that this is also a respiratory virus, and this may also behave in the same way. But at the same time, it should be very clear that this is a new virus, and it's very important that before making a final conclusion, we should study the pattern of this virus in different parts of the world. So right now, we cannot make any definite conclusion.
Dr. Naresh Gupta of Lok Nayak Jayaprakash Narayan Hospital said both young and old are susceptible to the virus.
It is appearing that the young ones are not safe. They also have to be careful. In fact, if you look at America, they had large number of these young adults who got hospitalized. And the last results we have that has been circulated so well on the media by you and everybody else says that the young adults actually constitute the larger chunk of patients who are getting hospitalized with COVID-19 in India. So if you look at 40 years or below, or if you go to 60 years, then majority of them are COVID-19 young ones, middle age, young age. And the elderly actually above 60 years constitute only 17%.
Punjabi film producer Savita Bhatti stresses the need to stay home and stay safe.
ਸਾਡੇ ਡਾਕਟਰਸ, ਨਰਸਿਸ, ਹੈਲਥ ਕੇਅਰ ਵਰਕਰਸ, ਐਸੈਂਸ਼ੀਅਲ ਸਰਵਿਸ ਪ੍ਰੋਵਾਈਡਰਸ, ਪੁਲਿਸ, ਇਹਨਾਂ ਨੂੰ ਇਹ ਵੀ ਆਪਸ਼ਨ ਨਹੀਂ ਹੈਗੀ ਕਿ ਉਹ ਘਰ ਰਹਿ ਸਕਣ। ਇਹ ਜੰਗ ਲੜ ਰਹੇ ਆ ਸਾਡੇ ਲਈ। ਸੋ ਆਓ ਇਹਨਾਂ ਦੇ ਬਲੀਦਾਨ ਨੂੰ ਵਿਅਰਥ ਨਾ ਜਾਣ ਦਈਏ। ਦੋਸਤੋ, ਮੰਨਿਆ ਕਿ ਐਤਕੀ ਵਾਰ ਰਾਤ ਕੁਝ ਜ਼ਿਆਦਾ ਹੀ ਲੰਬੀ ਹੋ ਗਈ ਹੈ, ਪਰ ਕੁਦਰਤ ਦਾ ਨਿਯਮ ਹੈ ਰਾਤ ਤੋਂ ਬਾਅਦ ਸਵੇਰਾ ਹੋਣਾ ਹੀ ਹੋਣਾ ਹੈ। ਸੋ ਆਓ ਹਿੰਮਤ ਨਾਲ ਉਹਦਾ ਇੰਤਜ਼ਾਰ ਕਰੀਏ। Stay at home, be positive, be safe.
Actor Simran appeals to people to remain calm during this lockdown period.
आप सबसे विनती करती हूँ कि जो परिस्थिति कोविड-19 की पूरी दुनिया फेस कर रही है, इसे ध्यान में रखते हुए हिम्मत बनाए रखें, अपना संयम बनाए रखें। इससे डरना नहीं है, लड़ना है। अपना और अपनों का ध्यान रखें।
The UN Security Council will hold a close video teleconferencing session today to discuss the COVID-19 situation. This is the first time the world body's top organ is holding a meeting on the raging coronavirus pandemic that has killed more than 88,500 people globally and infected over 1.5 million others. Council President for the month of April, the Dominican Republic, has formally scheduled a closed video teleconferencing BTC in connection with the impact of COVID-19 on the issues that fall under the Security Council's mandate. UN Secretary General Antonio Guterres will participate in this session. British Prime Minister Boris Johnson spent a third night in the intensive care unit ICU of a London hospital with coronavirus and is making steady progress. The 55-year-old leader was shifted to the ICU of St. Thomas Hospital in London on Monday night as his condition worsened over 10 days after he had tested positive for coronavirus and went into self-isolation. He has since received standard oxygen treatment but has not been diagnosed with pneumonia or required a ventilator to aid his breathing. 10 Downing Street spokesperson said that the Prime Minister continues to make steady progress. The coronavirus death toll in the UK registered another record daily jump of 938 fatalities on Wednesday to hit 7,097. In Sri Lanka, Indian expat community largely based in Colombo have pulled together to help locals as well as Indians stranded in the country. A report.
Indian expats are collecting contributions from others and helping several orphanages which are in dire need of essential supplies at this stage. Companies like Fonterra and Coca-Cola have also come forward to ensure supplies during lockdown. There are a few dozen Indian tourists stranded in Colombo and they have been provided with lodging and boarding at cheap rates. Indian government also supplied 10 tons of medicine to Sri Lanka on Tuesday as assistance to fight COVID crisis. Meanwhile, Sri Lanka recorded only 2 positive cases of COVID during the last 24 hours, as there are 139 active cases, with 7 deaths recorded so far. Santosh Kumar for AIR News from Colombo.
Back home, Lifeline Udan flights have transported around 248 tons of cargo till date during lockdown period. 167 flights of public and other private airlines have been operated under Lifeline Udan, covering over 150,000 kilometers. During COVID-19 lockdown period, essential medical supplies, including consignments of ICMR and others, are continuously being delivered across the country. Domestic public and private airline operators such as Air India, IAF, Pavan Hans, Indigo and Blue Dart transported medicines, consignments and other essential supplies to Srinagar, Kolkata, Chennai, Bengaluru, Bhubaneswar and other regions yesterday. Ministry of Civil Aviation is also coordinating for delivery of cargo of Ministry of Health, Ministry of Textiles, Department of Posts, so that the collective purpose of making the essential medical supplies to people in all parts of the country is served. Air India and Indian Air Force have collaborated primarily for Jammu and Kashmir, Ladakh, Northeast and other island regions. Maharashtra Chief Minister Uddhav Thackeray is all set to be nominated as the member of State Legislative Council from the Governor's quota. A recommendation in this regard was sent by the State Cabinet to the Governor Bhagat Singh Koshyari today. Currently, Mr. Thackeray is not a member of the State Legislature. Mr. Thackeray was sworn in as the Chief Minister on the 28th November last year, and according to the Constitution, it is mandatory for all ministers to become a member of either the State Assembly or Council within 6 months of assuming the post.
In Uttar Pradesh, the number of corona-positive cases has reached 410 and more than half of these cases are related with members of Tablighi Jamaat group. The spread of COVID-19 is now in 40 districts and 4 persons have lost their life due to the virus. Government has again appealed to the people of the state that they must wear masks before coming out of their homes since it has been made mandatory under Epidemic Act. A report.
Additional Chief Secretary Home Avnish Kumar Avasthi today said that doorstep home delivery system is working in the sealed hotspots of 15 districts in his state and process of sanitization has started. He requested everyone in his state to download Arogya Setu app, which is launched by central government. Mr. Avasthi said that the state government has provided 1,000 rupees to around 12 lakh laborers of the state. The state cabinet has decided to cut the salaries of ministers and legislature by 30% and suspend the Vidhayak Nidhi MLA fund for 1 year. This amount will be transferred to UP COVID Care Fund. Sushil Chandra Tiwari, AIR News, Lucknow.
To withstand the psychological impact of isolation during lockdown and cope up with the anxiety, the National Institute of Mental Health and Neurosciences in Bengaluru has come to the rescue of citizens. The director of the institute, Dr. B.N. Gangadhar, spoke to AIR News on ways to keep good mental health during this time of social isolation.
A cascading effects of preoccupations will drive us to this level of panic. We have to make sure that we come out of this stress. Being at home during this lockdown, not getting preoccupied corona illness is very important, and that can happen if we make sure that we use this time most productively, spend quality time with family members, indulge yourself in leisurely activities which you and me never had an opportunity to do because of our work pressure.
In Nagaland, in a time of crisis, many civil organizations and NGOs had stepped forward to provide humanitarian services to the people in distress. Our correspondent has more details.
In Kohima, Nehru Yuva Kendra's volunteers are working round the clock with the Kohima District Administration at the Relief Distribution Center located at Kohima local ground. Around 7 to 8 Nehru Yuva volunteers are working in shift basis every day from 9 a.m. to 7 p.m. by packaging essential basic needs like rice, dal and salt. Besides, they are also distributing the relief packages through home deliveries to stranded students at various locations as well as catering to the administration and staff working at the relief center. For AIR News, this is Asonyo from Kohima.
In Bihar, the number of corona-positive cases has gone up to 51 with 12 more cases reported today. Out of these new cases, 10 are from the same family of Siwan district. They had come in contact with a COVID-19 positive person who came from Oman. Sikkim will take a decision on the current COVID-19 lockdown after the Chief Minister's meeting with Prime Minister Narendra Modi on 11th of April. Talking to AIR News, Chief Secretary S.C. Gupta said Sikkim is safe as of now, following swift action of the state government, including sealing of all borders 10 days before the national lockdown and other preventive measures. Sikkim will take a decision on the current COVID-19 lockdown after the Chief Minister's meeting with Prime Minister Narendra Modi on 11th of April. Our Aizawl correspondent reports that with the spirit of maintaining lockdown as per the government guidelines, people in every corner of Mizoram are obeying rules in keeping social distancing to contain the COVID-19.
During the lockdown, people living in bordering villages in Sampai and Mamit districts have become more cautious, practicing social distancing more strictly. The villages of Ngentiang, located along Indo-Myanmar border in Sampai district, have taken social distancing and lockdown to the most serious height. They have put up gates at the entrance of the village with no entry board that announces that entry of any outsider to their village is prohibited. This is in order to contain COVID-19. Irene, AIR News, Aizawl.
In Gujarat, walk-through sanitizing tunnel at Ahmedabad station of Western Railway has got the unique distinction of becoming the first station on Indian Railways to install a walk-through mass sanitizing tunnel.
The walk-through mass sanitizer tunnel has been set up by Ahmedabad Division to ensure the safety of staff and passengers in view of COVID-19. The distance of the tunnel is 20 feet long, which can be covered within 10 seconds. Ahmedabad Division Railway PRO Pradeep Sharma said the tunnel is fitted with a sensor so that when a passenger approaches the tunnel entrance, it starts fogging automatically with WHO approved sanitizer. The tunnel has a capacity of sanitizing 25 to 30 persons per minute and consumes approximately 20 ml sanitizer per person. The system runs on a principle of vaporization, which converts the sanitizer mixture into vapor, which forms a uniform layer over the surface, which dries up quickly. Aparna Khun, AIR News, Ahmedabad.
In Tamil Nadu, the civic bodies, including the Greater Chennai Corporation, have made special arrangements to enable easy availability of essential items to the public during the lockdown. More from our correspondent.
It is commonly observed that people venture out during the lockdown period for purchasing essential commodities. To overcome the problem, the Chennai Corporation has arranged mobile provision stores in coordination with the traders associations in the city. They will be moving from street to street, taking packets of provisions to the doorsteps of the residents. A package containing rice, dal, edible oil and masala items will come for about 15 days for a family of 4 and is priced at 850 rupees. In the first phase, 530 such vehicles were flagged off today by the Corporation Commissioner Prakash, and more are in the offing. Jai Singh, AIR News, Chennai.
And now, before we end, the headlines once again. Government sanctions 15,000 crore rupees for COVID-19 emergency response. Prime Minister Narendra Modi and South Korean President Moon Jae-in discuss steps to tackle COVID-19 global pandemic. Home Ministry says states are effectively implementing lockdown measures and steps are being taken to help those stranded. Government says all efforts made to ensure adequate supply of fertilizers for upcoming Kharif season. Railways distributes over 8,50,000 cooked meals to needy people since 28th of last month. Government dismisses media reports and rumours about reduction of pension by 30% in wake of COVID-19 outbreak. And with that, we end the special news program on COVID-19.